I grew up with 3 older brothers, so I can be really loud. The title of my talk, of course, is Should Chaplains Care About Patient Care? Obviously, everyone's been tiptoeing and trampling upon the topic the whole way through. And of course, I think the consensus is pretty clear for all of us that the answer is yes. I mean, we need to be concerned about patient satisfaction scores. The thing that struck me as I thought about presenting today or talking to you about this was I find it interesting that we are sitting here in this place and having this conversation and the way healthcare has gone, because the whole healthcare idea started with us in the first place. I mean, it started with religious groups to begin with, and I feel at times like we're holding on by our fingernails to try to hold on to the whole institution like it's outstripped us. And I don't think that's lost on us as chaplains, but it's something that I think about regularly, is healthcare and the whole idea of caring for others. And like each of us has said, it's the right thing to do, and the whole idea of healthcare began with us in the first place. Again, as Steve talked to me about this, one of the things that struck me as I began to look more and consider more about it, oh no, go ahead, was 2 things going in that struck me. The first thing is the rising cost of health care, as Dr. McElwain talked about. But then in contrast to that is the decline in interest in organized religion. So I find that very interesting that we're, it sort of sounds like a double whammy, because we're in an industry that's got rising cost in every way, and then what we hear from the world around us is there's less interest in what we do and what we have to offer. But any of you that know me very well know I'm pretty odd, and so I actually hear a lot of promise in that for us as chaplains, because people that have a lack, I don't know about you, but people that have a lack of interest in religion, those are my people. I mean, because I don't like religion that much either. So there's oftentimes I'll go in family patients' rooms and will introduce myself as their chaplain, and they're like, well, you know, I'm not really very religious. And I was like, well, that's good, I'm not either. And so actually, you know, at the beginning for me, it sounds negative that sounds like we're losing. And there was actually, I looked up just so I would sound really like I did a lot of research here. I pulled up the American Religious Identification Survey in 2008, and they said the American population self-identifies as predominantly Christian, but Americans are slowly becoming less Christian. 86% of American adults identified as Christians in 1990, but only 76% in 2008. And then it says the challenge to Christianity in the U.S. does not come from other religions, but rather from a rejection of all forms of organized religion. But again, you know, for me, and I think for us as chaplains, that's not necessarily bad news, because those are our people, and those are the people that we are trained above all others, I think, to minister to, are these people that consider themselves non-religious. It's actually interesting. They broke it out. It said, based on their stated beliefs rather than their religious identification in 2008, 70% of Americans believe in a personal God. Roughly 12% of Americans are atheist or agnostic, and another 12% are deistic. They believe in a higher power, just not a personal God. So really, if you do the math, which is not my strong suit, that's 82% believe at least in a higher power, and then the other 12% are agnostic and atheist. And if you're like me, and my experience tells me 12% of the atheists and agnostics, there's probably a big portion of those are really just pissed off Christians. And they just decided they don't believe in God anymore, and they really just don't believe in religion. And God got wrapped into that whole thing. So I think the numbers are actually higher than the whole thing, than it actually sounds like to begin with. So anyway, as Steve talked to me, for those of you who don't know me, since there's some out-of-towners here, you're the lucky ones in the bunch, that I'm actually relatively new to the medical center. I've only been back in the med center for a year. The last 16 and a half years, I did hospice chaplaincy. And so Steve talked to me specifically for that reason, because I'm sort of new in the way I put it, is I'm sort of like a new employee at your hospital. You know, those are the people you want to get feedback from. You want to ask them questions because they have new eyes and they're coming to things fresh. And so that's really kind of the way that I approach this talk and to prepare, is sort of as a new employee, so to speak, or a new chaplain to the medical center. And I did a lot of reflecting back on my 16 plus years as a hospice chaplain, and the things that I learned that I believe, and Gary's asked me a lot. Gary's my boss, and so Gary's asked me a lot of these questions as well about things that I feel have transferred from my time as a hospice chaplain and now to the medical center. You know, that hospice experience for me was very isolating. I tell people that all the time, and I used to, when we interviewed chaplains for the last company I worked with was 10 years, and we interviewed, I was the lead chaplain and was in on all the interviews, and we would always, I was one of the things that I always tell people, if you like being around a lot of people all day long, this is not the job for you, because you're going to be in a car by yourself most of the time, by yourself. So I found it very isolating. But the other thing that struck me, and my wife and I talk about this a lot, that I really didn't understand until way beyond, or maybe even until I got to the medical center and kind of did more reflecting, and it's easier to, at least in my experience, to look back at something once I've left it, is it really made me grow up as a chaplain. I went straight from CPE, and the God's honest truth is, people ask me, oh, and it was actually more fun when I was in hospice, because it would always shock them. So, you know, hospice people are real lovey and touchy, and they're like, oh, what brought you to hospice work? And I said, oh, you want to know the real reason? They're like, yeah, what was your story? And I was like, they offered me a job. And, you know, when I left CPE, I say this all the time, I sent resumes to places I wouldn't even live. Somebody earlier mentioned Moline, Illinois. I actually sent a resume to Moline, Illinois, and I was like, hell, I don't even know where Moline, Illinois is, but I know I don't want to live there, but I sent a resume. And they still didn't offer me anything. So a hospice down the street was crazy enough to offer me a job. Actually, there was no job. I actually went and talked to the guy, and I thought, well, maybe it'll help me out later. And before I left his office, he said, well, you know, we don't really have a position, but I think I'm going to find something for you to do. And so that was my beginning in hospice. And then 16 and a half years later, Gary's to blame for me leaving hospice. So it actually turned out to be a great experience for me. And I grew up pretty quickly because when I went, especially in my last position, was very different. And so that's the one I focus on mostly, because I was there 10 years and I had a variety of experiences there. I was a hospice chaplain in the field, and then I had a year of temporary insanity where I went into administration and managed a branch for a year. I thought I'd gotten enough of that when I was on church staff, but I had to do it one more time and realized how much I really didn't like that. And I returned to the field and finished out my time in that. So these are some things I learned in that experience. Number one of the things I learned was most people don't know who we are, and they don't know what the hell we do as chaplains. They have no idea what we do. And I thought that would be different, to be honest, going to a faith-based institution. It's hilarious. I mean, there's a big cross out on, you know, in the logo and up on the side of the building and everything else. And just earlier this week, I left a patient's room in the ICU, and the nurse went in behind me, and I heard the guy say, yeah, it's really crazy. I didn't know y'all hired ministers to work in the hospital. It's like, it's an Episcopal hospital. But that's another story. People don't know what Episcopal is either. Then I tell them I'm Baptist, and they're really not sure what that is. So, but anyway, so I have learned that. I felt like that wouldn't be the case, but it is. And the other thing that Steve and I have talked about in preparation for this was something that I tried to never lose sight of when I was in hospice work, and I do it constantly here at the medical center, is I remind myself, try to on a daily basis, within the hospital setting, especially as far as staff members, is we are the oddballs. We are the outsiders. We're the strange, crazy people who have chosen to leave the, quote, religious setting and do ministry in a medical setting. And I live this every day in hospice because we were constantly trying to explain what it was that we did, because, you know, we're in a medical field. They measure everything, they draw up everything, and it's numbers, and they crunch numbers, and they're never sure what to do with us. But we're the ones that chose to do it. We're the ones that are the odd people out, and we have left that to come to this. And so I never lose sight of that, because I think that puts the onus upon us, because we're the ones that have done that. And the other thing that I find myself doing a lot is, or I intentionally started doing this when I was in hospice, was I use the phrase professional chaplain. I don't call myself a chaplain. I say professional chaplain. And people, and even the nurses on the staff and everything else, you know, in a conversation, you know, I don't walk around saying, hey, I'm Chad Hawkins, your professional chaplain, because that's sure to get laughs. But in the conversation, when that comes up, I talk about professional chaplaincy, and then I explain what that is. You know, I'm constantly doing that. And I think this job of explaining who we are never ends, because Gary and I were talking about this just a few weeks ago. With staff turnover, there's always new people that don't know who we are or what we do. So we're constantly explaining who we are and what we do. I enjoy talking about myself, so that works for me. But if you're not that kind of person, I think that's part of our job. I think it's part of what we do, and to explain to people who we are, what we do, and what we can do for them, because people really don't know. And they're, you know, and I think just being around ministers in general, for some people, is scary, depending on their background and their history and everything else. So focusing, as we were talking about earlier, focusing on staff, I am constantly reminding myself that I need to be especially sensitive to new staff, to introduce myself, to explain again what it is that I do. And I don't know about your hospitals, but we at St. Luke's have really done a recent, within the last year, have done sort of a reallocation of our staff, and we've put chaplains, staff chaplains all over the hospital, and then the residents are working with us in those areas, because we learned, and it was one of the things that I gave Gary feedback about, was I was introducing myself to people over and over, and staff were saying, okay, well, how long are you going to be here? And I would say, no, I'm a staff chaplain. And they're like, it didn't mean anything. So now I find myself constantly educating staff too about, we have staff chaplains, we have bishop's fellows, we have residents, we have extended chaplains, and people are like, we do training for chaplains here? And I was like, yeah, it's CPE, and I go through this whole explanation. And it's interesting, because I'll even have patients and families ask me those questions. And I'm surprised that they're as interested as they are, but they find that very fascinating. And said, well, I didn't know, you know. And it's, which brings me to the second thing that I learned was, in hospice, we are our own marketers. And I know that some of us bristle at the idea of doing your own marketing, but we are. And I learned that in hospice, because being out there physically by myself all day long and going into these nursing home and assisted livings and places like that where people had really never seen a chaplain ever, that had no idea what we did or what we offered, that it was constantly this idea of marketing for myself and about what I did and what I could bring the idea of. I remember as I was writing that I heard Zig Ziglar speak way back when I was in seminary, and I was struck. There's a lot of things he said, but the one thing I never forgot was he made this quote, and it goes along these lines, and this is a rough remembering on my part, but it was something along the lines of, none of us work for a company. We all work for ourselves. We rise and fall on our own effort and our own initiative. And I believe that, and I live that way every day. You know, we're always talking about, you know, the man and, you know, watching us and sticking it to the man and everything else. But ultimately, I really believe I work for myself. And what I do and what I don't do is really up to me. And it's the power that we give ourselves and what we're going to do. So I think, you know, as marketers, that no one else is going to do it for us. Well, and like I said earlier, they don't know what we do anyway, so they can't really market for us anyway. So we have to do that. And I think, yes, department directors and those, you know, all those suits are going to do their part for us as chaplains, yes, but I think it's like all of us have said today, it's us on the front line and us on the floor that are the hands-on that really make a huge impact. The other thing I learned in my hospice experience was flexibility. The last hospice I worked for, several people have talked about nonprofit. The last hospice I worked for the last 10 years, was a for-profit organization. And people ask me, well, what was the difference? Because the first one I worked for 6.5 years was a nonprofit. And they said, what's the biggest difference you saw between a nonprofit and a for-profit? And I said, you want to know the truth? And they were like, yeah. And I said, the for-profit wasted a whole lot of money compared to the nonprofit wasted a whole lot of money, and the for-profit didn't. They drove us nuts at times because he could squeeze, a penny and get 2 nickels. But, it was maddening at times because we had old computers and everything else, and we wanted brand new stuff. But they really did put the money toward patient care, so I really couldn't fault them at that point. But that was one of the main experiences for me. But because it was a for-profit, I think it also lit a fire under me because, again, obviously it wasn't a religious organization, and I never lost sight of the fact that if I wanted to keep a job and I wanted to work at this nonprofit organization, I was going to have to work my butt off, and I was going to have to stay really busy. And when I went to that company, I was the first professional chaplain that they had ever hired. They had an 80-year-old retired Southern Baptist preacher that was handing out religious tracts to the patients when I first got there. And to be honest, and this is not to blow smoke up my skirt, but the reason I got asked to come and take that job was because I had droned on and on with the RN that was my supervisor at the previous hospice, because I had educated him about what clinical training was and what CPE was. We needed to not hire people that hadn't had the CPE training, and I educated him on that and drove him nuts about it for the last 2 years that we worked together. Well, then when he left and he went to this other hospice, he called me up and said, we need a professional chaplain to come down here and work. And I wondered, so then if you don't know the area, it was Texas City, and he had to remind me where Texas City was because it's almost to Galveston. It's out in the boondocks. But one of the ways I stayed as long as I did at AMED, it was the name of the company. One of the reasons I stayed 10 years at AMED, and it was flexibility. If they would come to me and talk to me about doing something else, I said, yeah, I can do that. Yeah, I'll do that. They came to us at one point and said, we want chaplains to start going out and meeting with families initially and explaining hospice services. I was like, yeah, I can do that. We'll do that. And at first I was like, as we as chaplains, it's really a chaplain kind of thing to do. But it turned out to be great because I got to meet all of these families at the very get-go. And some of them I never would have seen because they never would have let a chaplain come and visit. But I got to meet them at the very beginning. So it turned out to be this really wonderful thing. And to be honest, I learned a great deal about hospice in general. But the other thing that I made up my mind was, because I knew the owner, it was, as I said, a pretty small company when we started, is I made up my mind that if they ever sat down, the owner ever sat down with the administrators, and they started looking at making cutbacks, and they started going down the list, when they came to my name, they would say, well, you can't let Chad go because he does this, and he does this, and he does this, and he does this. And so I think, and all of that preaching is to say, I think we as chaplains, with the changes that are coming in the healthcare industry, I think we need to really start thinking outside the box and be more comfortable with being flexible and finding ways to do it. My wife works for a school district south of town here, and when all the big layoffs and all the school districts started lopping off 900, 1,000 employees, their superintendent sent out an email and said, we need to lose 900 positions in this district. He said, but we've done the homework, and we lose about 300 people a year through attrition and retirement and just moving and all this. And he said, so we figured out that in about 3 years we could get that number. So we're not going to lay anybody off, but we're also not going to add any people on. We're just going to need you to do more. And I think that's what's going to have to happen in the healthcare industry as we go through this rough period, is we're going to be asked to do stuff that we wouldn't normally consider a real chaplain kind of thing to do. But if we want to stay involved and we want to stay a part of the healthcare industry, I think that's what we're going to have to do. We're going to have to think outside the box. This is another point that I actually was not going to cover, but the other thing I learned was that people don't communicate in the normal world the way we chaplains talk to each other. So, you know, we can say things to each other that would make each other cry and then have lunch the next day. Other people don't do that. I learned that the hard way. And that's another talk, like a 2-hour talk, or maybe more like a therapy session. But anyway, I learned that the hard way. Your administrator does not want you to talk to him the way you talk to chaplains. And we have to, I think we also have to ask ourselves, is our ministry relevant? Are we, you know, are we doing the build it and they will come thing? Or are we, again, being creative and thinking about our ministry and what we're providing? You know, are we providing something, you know, that people actually want and need in their lives? Or are we just, you know, giving out the same old refried beans? Research, you know, we've all talked about research. I am no researcher, so I just want to mention it to prove to you that I thought about it, but I am not a researcher at all. I think research is really important and everything, and I wish all of you that do that all the best. Knock it out. Do all the research you can. And I do think it's important because, again, the industry we're in respects that and needs that, and they want to see the numbers and all that. And I think we need more of that, and we do need those articles written. And so, bless you all. And the other thing about the talk, and Bill has talked about this, so I won't, again, give you refried beans, but it talks about, should we be interested in patient satisfaction? And I was going to say, and we'll just mention it, I really think that the title of my talk should be, should we be interested in consumer satisfaction? Because it's bigger than patient satisfaction, because it's the staff, the administration, it's everybody. And I actually share your belief, Bill, that I think it's the staff, at least 50-50, that we spend time with the staff. Because one of the things that I put on here is the staff will help you and make referrals to you or not. And so, and it's an interesting thing that I learned the hard way in hospice. And it was easier to see there because I had just I had 4 nurses that I worked with. And it became very clear to me that I spent a lot of time, or tried to, with all 4 of those nurses. And this one nurse, I never got many referrals from that nurse. You know why? She didn't give a flip about religion. And not only religion, she didn't care about God or anything else altogether. So I could beat my head against the wall all I wanted, but she was not going to help me out whatsoever. It didn't matter what I did. But the other 3, I saw a huge difference in the referrals that they sent my way, and good referrals that they sent my way. So I just think that we're going to have to work at being, you know, good team members and being a part of the team and having a voice in what we do. And one of the things that that I think we need to look at as professional chaplains in finding our voice is charting. You know, and I'll admit I was in hospice and things were a lot different as far as the charting and how that all happened. I'll be honest, I don't think my charting is all that good. I'm actually taking a workshop at this annual APC to try to do better at charting. There's a specific workshop up about, I can't remember the title, but it's talking about charting in a way that's helpful to the medical staff. So you actually chart something that's actually useful to them, rather than I prayed with the patient and they felt good, and you know, those kind of things. I actually had a nurse tell me the other day, she said, "Oh, so did you make them pray?" I was like, "No, I don't make people pray." So she's like, so it was, I don't know where that came from. That was just a random thought. But no, see, you're doing good if you can make them cry. I worked with a bereavement coordinator that actually believed that for a lot of years. And then the other thing that I wanted to share in closing, or 2 things in closing, is visibility. That I think that is such a huge thing that I've seen more so here than in hospice, because again, everybody was so scattered and all of those things. But I've noticed my efforts at being visible on my units has really made a difference here in the hospital and being there. I think the other thing that makes us really unique as a group is because we as chaplains go all over the place. We're not stuck on one floor or in one department. And so I think that's another selling point, for lack of a better word, for us to administration is our impact can be felt all over the hospital because we're not in just one place. We go everywhere. We go to the emergency department, we go to our floors, and we go everywhere in between, whether it's in food services or whatever it may be. So I think that also is a big selling point for us. You know, and one of the things that I've gotten in the habit of doing, and everybody's hospital is laid out differently. I hope yours is laid out better than ours is because it's really confusing. But one of the things that I've gotten in the habit of doing is even if I only have 15 minutes and I'm coming from one of my floors and I'm going back to the office, is I walk through my ICU units. And I walk through there. It's like Bill was saying about, you know, I speak to a few of the nurses, and do I spend a lot of time in there? No, but I spoke to 2 or 3 of the nurses because if the charge nurse comes out and said, "Did anybody see Chad today?" I was looking for him, and they're like, "Oh yeah, he came through here." Well, hell, they don't know I wasn't in there but like 5 minutes, but I went through and they saw me there. So I try to be visible in every unit every day. Even if I'm stuck in a meeting or whatever, I try to find 15, 20 minutes to run up on the floor and be visible in the unit. That even though I may not have time to make a lot of visits on a given day, that at least that they see me visibly up on the unit, and that I'm contacting and making connection with the nurses. The other thing that just dawned on me too is that, and I've gotten this feedback in roundabout ways from the nursing staff, but to talk to them, and I think Glenda mentioned this specifically, to talk to them about real life stuff. I mean, it's sort of like people talk to us about religious stuff all the time. It's like, oh, can we talk about the Astros, even as bad as they are? Can we please talk about anything but religion or spirituality? And we all get that because the nurses try to do that for us and go, well, how's your church? Or, you know, it's like... And so I think that we do that with the nursing staff in reverse. You know, we ask them about patients, we ask them about this or about something in the hospital. We don't get to know them on a personal level. And I think that connection is what makes the referrals and makes things happen. And again, I think it automatically turns into referrals because if we help them and we take care of them, then they trust us to take care of the patients and take care of their families in the same way. So I think that that's a big part of what we do. And then I thought this was going to be a little more formal, and so I wrote this really great ending, so I'm going to read it to you. Just to really snatch the cat out of the bag. So this is my big wrap-up. I feel that we're at a critical time in our vocation as chaplains. We can't just assume that we will be part of the discussions that are coming. There's a real push in healthcare for something, for example, like integrative medicine, which includes a wide variety of interventions such as meditation, massage, yoga, acupuncture, all of those things. And I think that we need to educate ourselves on these types of things, be involved in those discussions. As I started off saying, the combination of rising costs of providing health care and the decline in the interest of organized religion is a fact. What we do with the fact is up to us. We all have that choice as chaplains. Our perceptions are our own. We can opt for keeping the status quo and adopt the belief that my recovering alcoholic friend calls the true identity of a person in denial and say, I think this is all going to work out. Or we can throw up our hands in despair and say, what's the use? Or we can roll up our sleeves, get creative, and show the healthcare industry that we are professionals and that we really do have something to offer. I choose the latter and hope you'll join me. Amen.